Well, did you know that New Jersey is actually one of the leading states in the nation when it comes to mental health and happiness? According to a report compiled by healthcare staffing agency Soliant Health, here to tell us why is CEO of Preferred Behavioral Health Group and co-host of the Well Off podcast, Dr. Tara Chalakani. Doctor, welcome back to the show.
Good morning. I'm happy to be here.
We're always happy to have you back on. So listen, as a mental health professional, how do you explain New Jersey's positive rankings as one of the happiest and healthiest states in the country? And how is it that we're doing so much better than the rest of the country? Because to talk to New Jerseyans, I find us to be, I'm going to say, a realistic people. We're a hearty bunch. But I don't know that I would have said we were among some of the happiest.
Well, there's a reason right there. We're resilient, right? So that certainly lends to happiness. But Kara and Mike, I'm actually not surprised because New Jersey has a lot to offer despite being the butt of many jokes. When I think about what contributes to happiness, there is so much happening in the Garden State that is directly connected to that happiness. And one thing being, we are a melting pot. We're so culturally diverse. We're one of the most diverse states in the union. And when we feel connected and that we belong, we feel happy. So I think that we know that there are different pockets of maybe different nationalities or groups in New Jersey. And so there's always a place where we feel connected. And that is so important to our overall wellness. And another important piece, you were just talking about rip currents, which isn't great, but we have beautiful beaches. We have mountains. We have so much richness to offer. We're in close proximity to metropolitan cities, car rides away. We have so much to offer in this state, and there's a lot going on for free. So there's a lot people can do when they're not working that nourishes that part of themselves where they can play and not work so hard.
Yeah, I certainly feel that calming effect walking along the sand of a great New Jersey beach. So, in terms of behavioral health care, what is one thing New Jersey residents have as an advantage compared to other states, and what would you consider a disadvantage?
Well, as a behavioral health expert that travels around the country and is connected to a lot of groups, I speak to leaders in other states. And if you put it into perspective, New Jersey is one of the most, if not the most populated state. And we have resources at our fingertips. If you live in a rural location, you might have to travel an hour or more just to see a therapist. So we have so much right at our fingertips, which really is a luxury that many states don't have. And while we are in the midst of a mental health crisis and there can be people who feel that help isn't available, we really do have a tremendous amount of resources here in New Jersey.
And Dr. Tara, I know that this is something that impacts me personally. You know, we're in our summer months. It's very warm, but it's bright, it's sunny. As a healthcare provider, do you see differences in individuals' wellness and treatments based on the seasons of the year, which we, at least for now, still get all four of here in New Jersey?
Mm-hmm. Absolutely. And it's actually much more pronounced in our children's programs because first of all, the sun is great medicine and we all kind of feel those winter doldrums. And I see it in my practice where my clients in the winter months, they're more and more telling me how they're just not feeling themselves. They're feeling in a funk or down in the dumps. And then as the warmer weather and the sunshine comes, we see less and less in that. But with children, school is a major stressor. So we do find that there's a drop off in the demand for children's mental health services in the summer months because the big stressor of school is gone. So not only the workload, but the stress on family routines, maybe exposure to bullying or chaos or drama in friend groups. So there's definitely a nice calming lull that happens. And then we see it ramp up again in September.
Really fascinating stuff. Dr. Tara Chalakani, Preferred Behavioral Health Group and the Well Off podcast. Thank you so much for joining us once again this morning. We always appreciate your time and your insight.
Always a pleasure to be here and great show. I feel like I should be drinking wine with the tiara on. So thanks for the great show this morning.
That is the plan, my friend.
Exactly.
Thank you so much.
Thank you.
She's too funny. Wine with a tiara on. That sounds pretty good. Sounds like a
Wine,
weekend.
yeah, that sounds about right.
Sounds like a weekend sometime in October for me, but yes. All right, guys, we've got more New Jersey Morning Show coming up after this.